Once again this morning via Zoom, Dr. Kothary, the Chief Medical Officer for Dignity Health Central California Division. He's been keeping us up to date with all of the latest research and, of course, analyzation of the numbers here in Kern County and across the country. Dr. Kothary, thanks so much for joining us again this morning.
Oh, you're very welcome. Thank you for having me, Maddie.
All right, let's talk about the curve in Kern County because, again, yesterday we saw the biggest one-day spike in cases so far. 70 new cases reported in Kern, and this came a day after we saw, the day before we saw the biggest spike yet with 50 cases. So what does this tell you about what's happening here in Kern County?
Well, it tells me the disease is still here and it's not slowing down by any means.
Do you think that we are going to continue to see this dramatic spike in more and more new cases diagnosed every day, setting a record for the number of new cases diagnosed each day?
Unfortunately, I do believe that, and I think we'll see more of these patients being positive, and unfortunately a lot more ending up in our hospitals as well.
Are we seeing more cases being processed? Are they being processed faster? Does that have anything to do with the rise in cases that we're seeing?
You know, I definitely think there's, we have the ability to process a lot more tests. I know several of the hospitals are starting to process tests as well in-house. So you're absolutely correct. The more tests we process, the more positives we will get.
What's our testing capacity like here in Kern County? We've talked about this a lot, but we know that it's changing day by day. Are people who need tests and want tests, are they being turned away? Are there enough tests right now to go around?
You know, we're still trying to limit the number of people we test because we truly do not have all the test reagents or the ability to test everyone out there. I think, and the reason is we're not a hot zone. We haven't been designated a hot zone quite yet. Once we are, we'll have a lot more tests available.
What would that mean? How do we become a hot zone? What would that look like numbers-wise here in Kern County?
You know, I don't think they have a specific number, but if we start seeing a large number of positive patients, and unfortunately, if we also see a large number of mortality, that designates us as a hot zone.
So with 524 cases right now in Kern, our population near around 900,000, you don't think are we nearing that designation of a hot zone?
I'm not exactly sure the calculation they used to designate that, but I would assume we're getting close to it.
Okay. Let's talk about the new antibody tests. We know local hospitals are waiting on the CDC to start doing these, but other labs here in town and around the state are already performing these antibody tests. What if somebody gets an antibody test and it shows they have those antibodies in their body that they have previously gotten COVID? What does that mean for them? Does it mean that they can go back to the way they lived before? Can they change their behaviors at all and have any confidence that they won't get this virus again?
Well, here's the big problem. What the FDA did is they were very lax in letting these tests come out to market. So they've released, a lot of these tests have been FDA approved. The problem is the CDC is looking at about 60 different companies to try and determine which tests are actually good tests versus the not so good tests. A lot of these antibody tests that are out there, unfortunately, are testing for coronavirus, but not for the COVID-19. They're testing for regular coronavirus. So if you've had a cold, your test will come back positive for antibodies. That doesn't mean that you're immune to the COVID-19. So there's a couple of big companies that we're looking at currently. As soon as the CDC comes out with guidelines for that, we will have those tests in-house at all of our hospitals.
Do you think that people are going to get a false sense of confidence by going and getting this antibody test?
Unfortunately, yes. And the reason is we just don't know what these tests are actually testing.
If we do come down to a test that the CDC says, yes, this test for COVID-19 antibodies, what does that mean for a person? If they definitely have had and survived the COVID-19 virus, will they be protected from getting it again?
So definitely more protected than the average person. Now, we don't know if it determines full immunity. We believe it will, like any other virus. But what we're doing is we're going to be using it for healthcare workers to say, hey, go right back to work and don't worry about catching it again.
Okay.
We're assuming that it does determine full immunity.
Now, we know with the flu there are different strains, and every year the CDC looks at, okay, which strains do we think that we should include in this year's flu vaccine? Will it be similar with COVID-19? Will there be different strains of it every year?
Very similar, and we will have vaccines as well, and these vaccines will be somewhat effective. They may not be completely effective, but your symptoms, if you do contract them, will be very mild. So I think next year, or maybe even early this fall, we should start seeing some of these vaccines come out, and if not vaccines, some of the medications that will help prevent COVID or lessen the symptoms, if anything at all.
Let's talk a little bit about the test results that people are getting, because there's a preliminary study out of China saying that as many as 30% of the negative results in tests are actually false. Again, this is a preliminary study, but here in the U.S., some doctors say that they're seeing similar trends, that people could be getting a false coronavirus test, saying they don't have it, but that they actually do end up having it.
Yes, and the reason for that is the tests that we have here, the molecular tests that we're all doing, the test is about 100% specific. So what that tells us is if you have the virus, chances are, it's there. And if it's about 70% sensitive, and what that means is about 30% of the tests that are negative are false negatives. And so we have actually seen some of these cases in some of our hospitals across the country where a test comes out negative. However, we have a very high index of suspicion that the person does have COVID. So we keep them in-house, we keep them in the intensive care unit, and sometimes we'll retest them as well.
I want to ask you about masks now, because this has been such a hot topic lately. More and more people are using and making their own masks. What about children? If you have to take your children to a store with you, do kids need to wear masks? Should they? Is that safe? I've heard that some younger children, especially very young, it's actually not safe for them to wear masks because of oxygen.
Yeah, well, so the CDC recommendations has come out and saying anyone under the age of 2 should not be wearing a mask. And the biggest reason, once again, is these kids will touch their masks, right? And that's where you get infection. So kids, anybody above the age of 2 can wear a mask. You just got to remind them not to touch their faces. And, if you have hand sanitizer, which is a commodity right now, make sure you keep sanitizing their hands all the time. So it is safe, but you've got to use it properly, because used improperly, these masks will increase your risk of getting COVID by at least 13%. That's the studies so far that we've seen.
All right, so make sure you are following those guidelines. Dr. Kothary, thank you so much for joining us. We will see you again tomorrow morning, sir. Have a safe day.
Absolutely. Thank you.